patients. These are just things that I think about when I have to go over a imaging report with someone after an accident. Yeah, and it would be this way too when I was not working kind of like as a PI mercenary before. But um, when I have to go through these reports, there's going to be most people who are coming to you with some sort of X-ray report, MRI report, whatever it is. They don't have any background knowledge of what any of the stuff means that you're going to talk about. They've never seen an X-ray of their spine. They've never seen an MRI of their spine. They've never been educated on how to read through a report, what's normal, what's not normal, and so it's my responsibility to try to help them understand what we really need to be focused on, what kinds of things that are on this report are going to matter as far as their health and their long-term outcomes. And so I was always what always made my job difficult, particularly when I ran my own clinic in the past, was my my thoughts with imaging, and how I approached it was always I'm there to rule out any big problems, so, and that's how I still view imaging now with accidents, because some people have not been to a hospital or ER, depending on the severity of the incident and how they felt at the time. So, we send them out if we need to, or we wait for the reports from the hospital to come back to us. But uh, you know, my thoughts on sending out for imaging are really not big problems. Like, during this accident, did something get broken? Did something get dislocated? Is there some sort of big soft tissue swelling that we have to worry about? Things of that nature. So anything else that shows up, I'm kind of putting in the category of more than likely normal age-related findings. So we just have to make sure that we're not using. To me, I'm not trying to use those things as a lever to pull to get people to continue to sign up for for more treatment with me. And that was probably to my detriment before, but it's like, whereas a lot of times, like in school, and when you go through continuing education courses after school, um, most of the teaching around using imaging is directed towards how do you use what you're seeing on a report and what you're showing the patient on their x-ray. How do you use that information to create a story that convinces that person that they need your care to improve, that we're pulling this lever of emotion and fear, and and the patient's not understanding what they're seeing, to create a I don't want to say excuse, that's not the right word, but to create a narrative that what we're seeing is bad, and the only way it's going to change or improve is by committing to what I'm telling you needs to be done. And my stance always was, when I'm going over these reports, is I'm trying to explain to you how what we're seeing is may or may not be that relevant to the pain you're experiencing, and how a lot of these things are normal and expected, and how you can work to improve yourself so that you don't need me as soon as possible. My job, I always saw it in the field, was to get people away from needing me as quickly as possible with the least invasive means, and with the most education and most tools in their toolbox to help themselves and not need me. And so I was always trying to push people that direction. And so there's in kind of that healthcare profession, when you're dealing with reports of injuries from an x-ray or why someone's there, you do see that there's kind of one of two ways, and one of those ways, as in trying to use the reports to convince people that they need more care than they do. That path is, it's a business model, right? And the other path, trying to mitigate people's fears and to get them to understand that they are going to improve, and that we will make positive changes, and a lot of this stuff is is going to is going to get better no matter what, that kind of stuff. um, that's where you need to be pushing people towards. And so, just my little thoughts on that. A lot of people use X-rays to scare and as a business model to create more more patient visits, but to me, it's more used to rule out um, big things that could be wrong, and then to get people to be taking care of themselves as quick as possible. So, hopefully some people find value in that, and see you next time.